What's up guys? Welcome back to my channel. This is Dr. Evan, also known as the K-pop doc. Today I want to talk to you about Korea and America and some of the updates with COVID in those countries, and also specifically about the reopening of schools. I also wanted to talk to you about studying and ways to learn online and some of my experiences with distance learning. So one of the biggest updates in Korea has been a recent outbreak that has been linked to a church in Seoul, Korea. And that church has some members that tested positive, and at least a third of the 4,500 recent COVID cases in the past 3 weeks have been linked to members of that church. And the issue was that the pastor and some of the leadership in the church has not been cooperative with the government in terms of revealing information, in terms of contact tracing and being able to locate where these people were and why they had congregated at this time, and just cooperating with the government in terms of where these people have been so they can prevent other people from getting infected. So that has caused a lot of controversy in the news lately and has led to some of the coronavirus spread in Korea. Over 650 church members, as well as 7,700 protesters around August 15th have refused testing and have refused to abide by some of the government guidelines, and that has led to a rise in the outbreak in Korea as of recently. One of the other big pieces of news in the past, a couple months ago back in May, there was a club goer in Itaewon, which is also known as the Foreigner District in South Korea, who was linked to spreading coronavirus infections, and they were able to track that based off his smartphone and seeing the route that he took throughout Korea, and it showed that this individual, due to lack of social distancing and most likely not wearing a mask, had spread the infection and was the source of an outbreak back in May. So those are the two biggest updates in terms of some of the recent spread in South Korea. But in terms of the reopening of schools, the reopening of schools was originally set to open back up in February, but after the pandemic hit, the reopening of schools was postponed until May. In May, the virus seemed to be under control and schools were starting to reopen again. But due to these recent outbreaks linked to this church in South Korea, Education Minister Yoon Eun-hae announced that many schools in South Korea would have to close due to this recent outbreak linked to this church. There has also been some recent protests by the Korean Medical Association and many of the physicians in Korea due to the government's policy in wanting to get more medical students in the medical system to fill in the shortage of doctors to better prepare for a future pandemic, as the government feels that they need more physicians to be equipped for things in the future that might happen similar to this, and just to provide more doctors for the public. But many of the physicians, as well as the Korean Medical Association, feels that Korea already has enough medical doctors, and some of them feel very underappreciated for the work that they've done fighting the coronavirus during this pandemic. Next, I want to talk about New York and some of the recent updates. In terms of New York, schools are set to reopen on September 21st, and the CDC's guidelines recommends that schools can reopen in a community as long as the positivity rate is below 5%. And the mayor in New York, Bill de Blasio, recommends below 3% is where he wants to open. So this is something that in the US that varies case by case depending on the community, some of the guidelines that the mayor and the governor and just the school district in general have. Some of the other things that can vary is the ability to socially distance. For example, New York is much more population dense than some other places, so you have to take those into account. The other thing that really matters is supplies. So you might have a certain positivity rate that's below the guideline, but you also want to make sure that teachers and students have enough supplies, whether it be hand sanitizer, face masks, and materials to give to the students to have for in-person instruction and to properly clean the areas to prevent infection. The positivity rate in New York City has hovered around below 1% for well over 30 days in a row as of this recording, but it's most likely going to go up slightly once schools reopen. But we need to be cautious and aware and realize that this is an ever-changing process and we need to be flexible as the situation evolves. So one thing to consider when it comes to reopening of schools is that the impact that schools have on children is more than just education. Children are learning and developing at a rapid pace with the environment around them, and things that children have been missing out on with not being in school has a lot to do with their personal development, whether it be interacting with the children around them and their environment and socializing. Many of them don't have the resources at home. Many parents aren't able to provide proper meals for them, and a lot of children really rely on those school lunches to get by. Some children won't be able to eat if they don't get those school lunches, and a lot of times going to school is a way for some kids to escape a difficult home environment. It's something to consider when weighing schools reopening. The other thing that some students don't have equal access to resources. So some kids might have high-speed internet where another child in the classroom might not have access to that high-speed internet or to textbooks and to even a laptop or a computer. So the lack of resources is a big problem, and going to class and being in school seems to sometimes solve those things because all students are going to be given the same amount of resources in the classroom. So one of the biggest differences that I've noticed from talking to physicians and people in the community from both here in the US and in Korea is that there's a lot more transparency in terms of sharing of personal information and private information from healthcare records and cell phone data to the government to provide awareness. One example was that outbreak that I spoke about earlier from Itaewon, South Korea. So right now in South Korea, they have apps that allow you to track and trace someone that had a recent coronavirus infection. It tells you the restaurants they visited, the cafes they visited, and it provides on a map all the people that have tested positive for the virus and where they've gone, as well as recent hotspots for infection. None of that would be possible if there was laws in America like we have right now, such as the Fourth Amendment. The Fourth Amendment prohibits unreasonable searches and seizures. So this was actually very similar. Even in Korea, there was a lack of sharing data between the government and individuals. But back in 2015, MERS opened up the floodgates in terms of allowing the government to have access to some of that personal data. So back in 2015, when MERS happened, the Minister of Health was given access to access data without a warrant. So this carried on to today with the coronavirus. So any person that has an infection, that got infected with the coronavirus, the government can actually track their cell phone, where they've been. They are able to access CCTVs, so cameras that are placed throughout South that tracks where this person went, whether they were wearing a mask, and share that data publicly to other citizens and share it via an app where they can contact trace, and all the data is open for other people to use and to avoid these hotspots. So I think that is one huge thing that I've noticed between South Korea and America that's a big difference. The other thing is when it comes to arriving on planes, when quarantining, it's mandatory for people to download an app and for them to be contact traced. In South Korea, they're very strict with making sure that people are quarantining, almost so much to have them report their location and their temperature back to the government on a daily basis. Lastly, I want to touch on distance learning and some of the challenges that it's posed, but also some of the advantages that students have when learning online and possible outlook into the future of education and learning. So as a recent medical graduate, I've been through medical school, college, and obviously high school. I've experienced learning both in person with a professor and also online watching videos. And I'm sure as many of you can relate that sometimes it's a challenge learning in person with a professor, because just because you know a topic really well doesn't necessarily mean that you can teach it. I'm sure you've had that professor who goes on and on about a certain topic, whether it be a calculus equation or some type of physics or math problem, or even something as simple as like history or a story that they can't articulate well. Sometimes you can be an expert in a topic but not be able to teach. So often when you're in a traditional classroom, there's, let's say, 20 students. Not everyone learns at the same pace. So one person might be getting a certain topic faster than the other, and the other person might not be getting it. So one person falls behind while the other gets ahead, or vice versa. When a teacher is going slower to accommodate for students that aren't learning, the person that is understanding might fall behind. So the advantage with online learning is everyone can go at their own pace. So you can learn a topic and be able to categorize your weaknesses according to how you're learning and at the pace you're going. One of my favorite resources as a college student was Khan Academy, and it's something that's being incorporated into schools. So he was actually sponsored by Bill Gates, his name's Salman Khan, to provide free online education for people worldwide, whether it be math, science, English, and preparing for SAT, MCATs. Everything's free online and everywhere to anyone worldwide. And this resource I thought was really great because it comes with associated quizzes to track, that parents can track, and also learners can track where their weaknesses are, and also be able to take quizzes based off those weaknesses. So I really feel like that's a new look into the future of education as technology evolves, and especially going through this coronavirus pandemic with learning online. We're being able to see the value in using technology and tracking students' retention scores and targeted learning as opposed to just focusing on just one classroom as a whole, being able to see how each individual student is doing and tailoring their learning plan based off their weaknesses and strengths. So it's something that I'm excited about for the future, and while it's been challenging, I think it can help a lot of students here in the future as we transition back into the classroom. And to wrap up, I think both Korea and US and really every country in the world is really working together to fight this pandemic. And one way is not necessarily better than the other. I think we all need to learn from each other and to be open in being able to admit when we make a mistake and to adapt and to learn from each other and to really work together as all these countries are doing. And I think that at the end of the day, we're going to come together and we'll be a happier and healthier world because of it. So thanks for joining me again on this video, guys. And as always, stay healthy and keep wearing your masks. And if there's any more topics that you guys want to talk about, feel free to leave a comment below, and I'll talk to you soon.